So what do you need? Like, what's the licensing that you need to operate the type of business that you operate?
So for a clinic in our space, right, you need a couple of things, right? So the way we operate generally, like I mentioned earlier, we would like to go in the area. We typically would talk to the Department of Health. So you need like a general stuff that you would need for a regular retail business. You need like a business license. Um, for us, you need what is called a site ID, right? So you'll call the Department of Health, and depending on where you are, if you plan on billing like Medicaid, you need like a CMS number. So you typically would contact CMS, which is the Center for Medicaid and Medicare Services. So you need a license for that. You might need a um, like Cliff was saying, like NPI numbers, NCPP numbers. So it really just depends on what vertical you plan on doing. So if it's STD or if it's primary care, will determine what type of license you need. But obviously, you actually need a physician who has a physician license. But it really just depends. But for us, it's very simple. Is the Department of Health give us what we call a testing site ID number, and that what kind of gives you the ability to provide the testing and treating. Then you need a clear, so that way you can be able to draw blood and stuff like that. So there's certain licensing you need. It just varies depending on what state you're in and what modality or what vertical that you're
How
kind of
how long does
servicing.
that take, right? Because a lot of times you apply for something, and it's like,
Oh, it definitely takes time. Dealing with the bureaucracy of the government definitely takes a long time, and it costs too, right? So, for us, to get one of our clinics up and running to get the license, it typically takes about 90 days to
mhm.
get everything, just because there's so many codependencies and stuff. Because you got to wait for this to come in before you can apply for that, and you have to wait for DEA. You have to wait for certain things that you need. But yeah, but it generally takes about 90 days.
And how much would it start? Like, if I wanted to open up a clinic, how much operating
And
money?
you need. So for us to open up a clinic, it costs about 350K to get a full brick and mortar clinic up and running. To get a mobile clinic, it'll range you anywhere from 250, maybe a million, depending on how lavish you want the mobile clinic. Ours are pretty small, so we try to keep it between 2 to 300,000. Um, but that's generally what the barrier entry would be to get into what we do.
And the mobile clinics, when we talk about mobile clinics, your mobile clinic could be a 2 exam room mobile clinic with a waiting room on wheels.
Mhm.
Or it could be 1 exam room like ours. Ours are Sprinter trucks. So we get Sprinter trucks and we put them on the road because it's a lot easier and quicker to get them on the road. So we don't want to have to wait for a build out of a big mobile clinic that has 2 exam rooms, or have to worry about licensing for that truck on the road, because that truck is that big. That means they need to have a CDL license to drive that truck.
Yeah.
So now we put ourselves in a whole nother situation financially, which we try not to. So we try to get the smaller mobile clinics so we could get it out the door quicker and we could get to work. And that get to work for us is 10 to 20 new patients per day per mobile clinic,
Okay.
right?
Yeah.
So
That's what I was looking at. I'm like, obviously, from an operation standpoint, and obviously from the business mind, it's like before I can create the clinic, I need to know how many patients
Right.
I have to see on a
Exactly.
daily
Exactly.
basis, on a monthly basis, on a yearly
exactly.
basis,
Exactly.
because that will determine obviously how
Your
much I'm going to need, the
profitability.
profitability.
Yes.
Absolutely.
So
Absolutely.
when you're looking at that, that's something you have to learn.
Right.
But when do you realize, okay, we've hit our number here, let's scale to another area, let's get another truck?
To be honest, I mean, like I said, we said earlier, I mean, the need is so vast that even with the 12 or 15 mobile clinics we have now in the 8 locations, I think we actually have 10 because I think we signed 2 new leases this week. We're still not covering the whole state of Florida. There's still so much that we need, and that's why we created Healthy MD, because we feel as if just future thinking and trying to future proof our business. We want to make sure we're able to kind of get to a more of a nationwide platform, but you just kind of get economies of scale. So for us, we know that once we get to a certain amount of patients, we generally will put 2 or 3 mobile clinics out, and then we'll move on to another area. So once we get enough affiliate partners, or when I say affiliate partners in the community, I'm talking about the halfway houses, substance abuse clinics. Once we figure that out, and we know that this clinic is sustainable with at least about 200 active patients,
Mhm.
then we'll move on to the next. Because definitely don't want people say don't put all your eggs in one basket. For us, we're like, we're gonna put all our eggs in that basket and gonna protect the heck out of the basket. So we put all our eggs in that one basket in that one clinic, grow it, and then we'll move on to the next location.
Mm.
Yeah, and because we're so knowledgeable of the industry and what we do today, we don't have to our team already did the work on where we're going next.
Yeah,
right?
You know where we're going for
We-
the next
Yeah,
3 years.
exactly. We know what cities we're going to. We know what states we're going to. We know what areas. We know if we're doing a mobile clinic or a brick and mortar. We know if we're doing brick and mortar and 5 mobile clinics, because some of our brick and mortar is just hubs
Right.
for our mobile clinics. And our mobile clinics go in 5 different directions every morning and go to different communities.
Yeah, like I said, the reason why we have more mobile clinics than physical locations because our business model is different, right? We don't open up a clinic like Cliff said and wait for people to come. We bring the services to people who wouldn't otherwise come to a clinic. You know what I mean? Or otherwise even come to a doctor. It's funny. A lot of the people that we service, I mean, we're like their source for a physician. I mean, because they're like, I'm not going to the doctor. We don't go as a culture. We don't normally go to the doctor unless it's broken or bleeding. We're not going to the doctor, unfortunately. So we have to actually, kind of bring the services to them.
So, as far as the business model, how you make money from this? From Medicaid, people coming and you're
So-
charging them the Medicaid, and the Medicaid is reimbursing it. Like, what's
Right,
the, what's
right.
the deal?
So
Nah,
not
hold
not
on. Remember, all the healthcare services are free.
Right.
We don't charge for it at all. We don't bill insurance for it. That's another reason why our license structure, we don't have to get as many licenses as
'Cause we're not billing.
as another clinic because we're not billing. But it also gives us autonomy in some cases as well. And this is why you need good attorneys, because good attorneys will break that down for you and say, yo, you're making $25 to see this patient for a visit. That $25 does nothing for you. Where's the money at so you could continue to provide this service? The money's in the medication. The medication costs $1,000, $2,000, $5,000, $10,000, depending on the medication or the ailment that you're providing for, right? That you're solving for.
Mhm.
So when our attorneys broke it down to us and they said, you could do this, but this is going to stop you from giving away food vouchers, transportation, housing, all of those stuff. You can't give that stuff away when you own a clinic. When you own a clinic, that's illegal for you to give out
Yeah, they call that
food
inducement.
vouchers. They call it inducement. So we had to figure out the best way to provide for our community without billing CMS or Medicaid, because CMS and Medicaid, that's government they're government funded, so they're paying you. If they're paying you, they got a whole different rules and regulations behind CMS and Medicaid.
Right. So
That's why we don't get involved with them. We don't use them at all.
Right. So for us, man, so all the testing and all the medical services are free. So the remuneration comes from the filling of the prescriptions, right? So similar to if you ever been to like an urgent care, we have like dispensaries in our clinics. So when you come in, if you ever been to like urgent care, you'll go in there, whatever issue you have, typically when you walk out, they can give you an antibiotic or they'll give you a prescription right then and there. So our clinics are kind of built the same way. We have dispensaries in them where you come in and the medical services, which is the testing, is absolutely free. But the treatment, which is the medication component, is where we actually make the revenue. So people will come in and they may not have insurance at all, right? Because for us, we are open to any and everybody. But our patient services and our case managers would help that person, one, procure insurance in order to make them a profitable
So,
patient for us.
okay. So anybody can go in. There's no charge.
No charge. But if you actually,
If you have
if
something,
you have something,
the-
and let's say you have something, you have insurance, then we'll bill your insurance for the actual medication treatment. But if you come in and you don't have insurance, obviously the medication is very expensive, then you'll go through our patient services. We'll help procure your insurance to help you get the actual treatment. So we only make remuneration from the treatment.
and that's like Medicaid.
So it's not generally it's not Medicaid, because for the program that we're on, the
can't be
program that we do, it
Medicaid.
can't we can't bill any Medicaid or Medicare. We can't do any government payers because of the fact that we give away the medical services for free. So it's generally either exchange health plan that they're on or some type of commercial health plan.